Welcome, everybody. My name is Marty Mascari. I am a contractor under the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC, um, which is under the both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area.
Hmm.
Um, we are pleased to have our friends here today at the Area Agency on Aging and at the Better Business Bureau Foundation out of Houston um, to talk about our Medicare Mondays. What's new in 2025 and an opened enrollment scams. Can they do that? But before we get started, we're going to go over the requirements for those of you that are joining us for CEUs. If we could advance one slide, Simon, that would be great. Thank you so much. So, for those of you that are joining us today for CEUs or for certificates of attendance, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. That's who we're set up to provide them for. Now, if you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process and get the certificate um, and submit it to your jurisdiction. But please know there's no guarantee that they'll take that. And there's really not a whole lot I can do I have no leverage to get them to take that. The only thing I will say is I've had people tell me they've had jurisdictions take them, and I actually have received emails from some of the jurisdictions asking me for a copy of the slides or additional information on the program so that they could decide whether they wanted to accept them or not. And you're more than welcome to have them do that. But we're also offering a certificate of attendance for anybody who would like. Today's webinar is worth 1.5 hours of CE credits. You must complete the entire webinar live and the Q&A to qualify. You must also complete the Google evaluation survey, and I underline must. You've got to have completed the Google survey. When you close out of Zoom today, it should ask you if you would like to take a short survey. That will take you to our Google survey if you click on that. If you miss that for some reason, you'll also receive the Google survey in a follow-up email that will go out tomorrow with that information. The Google survey will be up and available for you to complete until the 2nd of December. And please give us about 4 weeks after that to get certificates out to you. They all go out in one bunch, and it takes us a while to get that whole group ready to go and get them out. So if you give us that much time, and feel free to call us after that, but please give us that much time. It takes time to answer lots of emails and calls about CEUs. When I start getting them next week, that just slows things down. So I'm going to turn it over to Simon Manrique to introduce our speaker. Is that right?
Yes, sir. Yes, I am. Good morning. Good morning, Marty. And good morning, everyone. Thank y'all so much for being here today. And like I said, today's presentation is going to cover a couple of different things. What's new for Medicare in 2025? And I'm going to start out by introducing our first speaker. Her name is Leslie Kelton. She's already been with us for about a year, and she is a certified benefits counselor. And this is her first midweek Medicare presentation. So applause, applause, applause for Miss Leslie. And anytime you're ready, Miss Leslie, go right ahead, please.
Well, good morning, everybody. It's nice to be here, and it's nice to be representing the North Central Texas Area Agency on Aging. I am Leslie Kilton, and we are the SHIP Center here, and that stands for the State Health Insurance Assistance Program. And it was this, you can go ahead, Simon, next slide. We are federally funded under Section 4360 of the Omnibus Reconciliation Act. And this SHIP programs were established by Congress, and we are funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. So that's a good thing. Lots of people don't know what SHIP can do, but here are some things we can do. And that is to understand cost and coverage of your plans. You can compare your plans. We can help you do that. We can help you enroll or change your plans, and we can help you with billing issues. So if you need any help with any of those things, you just let us know, and we are here for you. There's one in every state, including all those places, the Virgin Islands, or the whatever they are. So anyway, so we can do all that for you, and we're a good resource for people. So we're a central point of information, and we want you to know that we're always available. So, all right. Now there are 54 ships. Here's what we're talking about. The next slide, Simon. There's one in every state: Puerto Rico, Guam, DC, and the U.S. Virgin Islands. And there's 2,200 local programs and 12,500 counselors. And we educate 4 million individuals, and we have over 2.5 million counseling sessions. So we're busy, but we're always available to help. And for us here at the Area Agency on Aging, here are some services that we offer. We have services for older adults, but we also have service for the caregivers of the older adults, and that's important. A good resource for everyone. Next slide, Simon. Here's the other side. And then we also service people of all ages. This is the Area Aging and Resource Disability Center. The Aging and Disability Research Center, forgive me, all new to me here. So we have services for people of all ages with disabilities, and service for people who are caregivers for those people. And we also some short-term respite things as well. Now, we would love it if you would come and volunteer with us. We have a great group of volunteers already, but we're always needing more to reach out to help more people. And Sharon Rowbottom is our volunteer coordinator. And we're going to watch a quick video on how wonderful volunteering is. We have people who work here who still volunteer too. So, and then, yeah, here are some program opportunities. Benefits counseling, that's what we're doing. Simon, myself, and Felicia, we all are benefit counselors here. And then Senior Medicare Patrol, who you're going to hear from later, we partner with them, and we're very grateful to be able to do that. We also have long-term care ombudsmen. So if you're in a long-term care facility, they protect the rights of nursing home and assisted living residents. And then we also have health evidence-based programs for taking control of your health. And they teach you all kinds of great things and have classes, and it's wonderful. So, okay. And then how the volunteers can choose how to serve and when. And the different positions, you can do any of those. You can just do Senior Medicare Patrol, or you can be a benefit counselor as well. And you can figure out the time that works best for you. And we serve the North Central Texas 14 county regions, which is everything except Dallas and Tarrant County. And you will undergo training, so you'll know more than all your friends. And you have to get your background verified, and you'll get lots of continuing education. And it's you can contact Sharon at this number here on the screen if you have any questions. And then I think there's a video coming up, right, Simon? Where's the video? You don't have it?
Right.
Okay. All right. Let's just jump right into the 2025 Medicare updates. Next slide. All right, here's what we're going to talk about. We're going to talk about a history of Part D, the Inflation Reduction Act, IRA of 2022, and then 2025 prescription drug plan, what's happening with that, big news, and the Medicare prescription payment plan, more big news, and then any programs that are available to help with your drug costs, and then what's happening with your Part A, B deductibles, coinsurance, and premiums, because they, change every year. So, okay, so here's the history of Part D. It was the Medicare Modernization Act of 2003, and then that Part D program became effective in 2006. It had a donut hole and 5% cost sharing. Cost sharing is another word for copay, and then in the catastrophic coverage phase. And then in 2018, there was a bipartisan budget act, and it accelerated the closure of the donut hole by 1 year, 2019. And then the Affordable Care Act of 2010, ACA, they provided a gradual phasing down of the donut hole by 2020. And then we had the Inflation Reduction Act of 2022. Next slide. And this is what the Inflation Reduction Act has. It limits the monthly out-of-pocket copays for insulin to $35. We can talk more about that if you have any questions. It eliminates the cost sharing or the copay for adult vaccines covered under the Part D program plan. And then in 2024, it expanded access to the Part D low income subsidy, which is also called Extra Help. All right. So here's some more about the IRA. It allows Medicare to negotiate with drug manufacturers for the price of some Part D and Part B drugs. And this will start in 2026. And there's some really expensive drugs that their price will be reduced in January of 2026. And we're kind of all looking forward to that. This year, the caps, this in 2025, starting in January, you out-of-pocket Part D costs will cap at $2,000. And so the 5% coinsurance for the Part D catastrophic coverage was eliminated in 2024. And then we're going to have checks on the annual rise in costs of drugs and Part D premiums. So they can put limits on drug prices and on Part D premiums. So that's all good news. So what's happening this year is for a standard benefit, their deductible is going to be $590. There are some plans that will offer less, but that's the standard, kind of the base. And then your maximum out-of-pocket is $2,000. So once you reach that out-of-pocket expenses of $2,000, you won't have to pay any more for the whole rest of the year. If you don't meet it, then you still have to pay your co-deductible, your copay. So now what counts towards the $2,000 limit, which has been a source of a big discussion, is any amount you pay towards the plan's deductible. So if it's $590 or $450, you pay that, and that counts towards your $2,000 limit, plus any of your co-payments that you pay for your drugs out of pocket. So it's what you pay goes towards that $2,000 limit. Okay, next slide. So what is not counted are your premiums. So some of the prescription drug plans have premiums, some of them don't, and so that's not going to be counted towards the deductible. And then there are some drugs that won't be covered by your plan, but if they're not covered by your plan, you can always ask for an exception. You can always call them and ask if you could just add this, and so they'll see what they say. So if there's any charges for pharmacy services, like delivery fees, they're not going to be counted toward the deductible. And then if you have other insurance paying for part of your drugs, those amounts don't count towards your $2,000 either. Okay, next slide. All right, so the other thing they're adding in this year is this Medicare prescription plan. And this is, it's going to have several different acronyms, but right now I think we're using MPPP. So if you have if you go to the pharmacy and they say, "Oh, your drug is $500," and you're like, "Oh, I cannot pay for that." So you can, they'll, I'm not exactly sure how it's going to work, but we're thinking that you can go and ask your health insurance company um, to give you a payment plan, and they will do that. Now, if it's not going to be the pharmacy, you're not going to pay the pharmacy, you'll pay the insurance company. So they will offer you the option to do this. Now, you don't have to do it if you don't want to, but if it helps, you'll just spread out the payments of your drug all through the whole year instead of once. And I have a chart that's very helpful to kind of see. This is the chart. So see, it comes out to be the same amount of money, but instead of spending all that money in January and February, you just spread it out through the whole year, every month. Okay? And that's with your insurance plan and not the pharmacy. And so here's some questions, some that we can look at. It's not going to lower your prescription. Well, it limits the amount you will pay out of pocket. So that means it will lower some of your costs, but the actual prescription won't be lowered. And then, but the prescription plan will let you pay throughout the calendar year. And then who can get it? Anyone with a Part D plan, either with traditional Medicare or Medicare Advantage. Um, so most of the people who have high out-of-pocket drug costs will benefit the most. So the cap is automatic. The $2,000 is automatic, so you don't have to do anything about that. But remember, it's just your out-of-pocket expenses, and it doesn't include the actual cost of the drug. And so this is voluntary program. You must opt in, and that's through your insurance company. And then if you decide just to pay for your medicines, you'll do that at the pharmacy. But then if you go through the insurance company, they're going to bill you every month. Okay, next slide. So if you are having a lot of trouble paying even that much, even over a monthly period, then there's this extra help or low income subsidy. It is income based. And if you qualify for it, you have to have an annual income must be below $22,836 per person. That's $1,903 monthly. And then for a married couple, it's $2,575 monthly. And then your resources must be below 17,220 individual or 34,360 for a married couple. And if you qualify for it, then you're going to pay, I'm back up, Simon. Yeah. If you qualify for it, then you will have your drug plan premium will be $0 and $0 for your deductible. And then both the generic and brand name drugs are reduced. They're pretty cheap. So if you get any level of extra help now and meet the qualifications for next year, you'll get these automatically. You don't need to reapply. Okay. Thank you, Simon. So here's like a timeline for the Medicare reforms. So in 2023, vaccines didn't have copays, and then your insulin was limited to $35 a month. And then in 2024, more people were qualifying for extra help, and they eliminated the 5% coinsurance for the catastrophic phase. And then in 2025, now we have a $2,000 annual cap on prescription costs, and they can spread out the payments over the year. Okay, so now we are having some increases in our Part A premiums and deductibles. So it's going up to, for the inpatient hospital deductible, it's $1,676 per benefit period. And so the first 60 days in the hospital, there's no coinsurance because you're paying that $1,676, and then days 61 through 90, it's $419 a day, and 91 through 150, it's $830 a day. A benefit period starts the first day you go in the hospital, and it will end once you're out of the hospital for 60 days. And then a new benefit period will start. And then we have the deductible over again. So keep that in mind. And then the skilled nursing facility, it's days 1 through 20, that's zero copay. And then 21 through 100, it's $209.50 a day. Okay, so next, the premium is also going up. So if you have worked 40 or more quarters, then your Part A premium is zero. We all know that. And then if you work 30 to 39 quarters, then you get $285 a month for your Part A. And then 29 or fewer quarters, it's $518 a month. Okay, but if you qualify for the Medicare Summary Savings Program, that could possibly take care of some of that as well. Next. All right, here are the Part B premiums and deductibles. The Part B premium is $185 a month. It was $174.70 this year, and now it's going up to $185. And the annual deductible was $240 this year, and it's going to $257 next year. And then the co-insurance stays at the 20% of the Medicare approved amount. Okay, here are some resources. I just want to mention that the PAN Foundation is an excellent resource. They have all kinds of drug ideas on ways to get your drugs paid for if you can't afford them, so you can look into that. And then, of course, you can contact your local state health insurance assistance program. That's us. And then if you wanted to enroll in the Extra Help program, that is at ssa.gov, and it's on there under the Medicare part, and you just, so it's through Social Security. So you just do that, get online and do that, or call us and we can help you do that. Okay. Okay, let's see. Do we have any questions? Okay, so here's our contact information. And if you wanted to find a ship in your area, you can call this number toll free. And next.
If you all, just to let everybody know, I don't know how many new people we have on, but if you all have any questions, please put them in the Q&A. You're more than welcome to put comments in the chat, but it always helps if we can get the questions in the Q&A so we can get to them more efficiently. And there is one that's just popped up, but I haven't read it. There you go.
Huh. Where is it? I don't see it.
It's in the Q&A, and it says it seems that the premium amounts based on quarters worked in.
Oh, no. Yeah, no, that's not new. That's been that way for a while. Let's see. I'm looking for it on my thing here. Yeah, no, it's just, it's always been that way. If you have to work 10 years or 40 quarters to get the free a Part A premium. That's kind of the government's way of thinking you of being an American. And but Part B has always had a a premium. So.
And Susan, there's a link to the slides. I'll put it in again in the chat. I'll put that in there again so you can download the slides and have those pictures for yourself.
Mm-hmm. The premiums for Part A are just going up for next year, but the same, they probably go up every year. So, okay.
That's all I see there. Great job. Oh, there's now two more just popped up.
Okay, wait, let's see. We got, yes, we can. Oh yeah, you can get the slides. You can download them yourself. And so, okay, so if somebody's getting coverage from the marketplace and they also they cannot have Medicare. It is illegal for the marketplace to sell them a policy if they are on Medicare. And I just did have this situation come up. So they can drop their Medicare, like if they're having to pay for the Part A and they can't afford it and they would rather use the marketplace, then they can do that. And then they can't have either Part A or Part B. So just so you know, you can only have marketplace or Medicare, not both. Does that answer your question? Oh, Melinda's going to answer that too. So, okay. Anyway, so now we're going to turn it. Oh, the marketplace is the health. It's the health insurance website for it's health. I can't even think of what it is right now, but yeah. So Melinda will answer that. But okay, so now I want to say that we are so glad to be partnering with the Senior Medicare Patrol with Angel Hanzik. And currently, we are still in the open enrollment period. It started October 15th and it goes through December 7th. And she has got a lot of information about how we can stay aware and what to know about when we're looking at our plans that we might want to change to. And so I'm going to turn it over to her now. All right, there you go. Thank you, Angel.
All right, wonderful. Thank you so much. Let me see if I got it here. Perfect. Thank you. Well, thank you so much, Leslie. That was such wonderful information. It's so important to know what the changes are going to be, especially once January hits and everybody's looking and is like, why is my plan different? What's going on? So thank you so much for sharing that information, Leslie. Okay, let's see. There we go. So we will be going a little bit over open enrollment and specifically the do's and do nots of open enrollment. I am Angel Hanzik. I am the program director for the Texas Senior Medicare Patrol. And this one is going to be a bit more interactive. So I will be asking y'all to put your answers in the chat for some questions that we're going to be having on the slides. Oops, excuse me. So today we're going to be talking about what the Senior Medicare Patrol actually even is. We're going to talk a little bit about open enrollment and then also be going over the do's and don'ts for insurance brokers and agents. So actually understanding the rules that they have to follow whenever they are actually marketing these plans to beneficiaries. So first up, the Texas Senior Medicare Patrol. What is it? So we are actually a federally funded program through the Administration for Community Living. We are specific to the entire state of Texas. So corner to corner, we are there, but there is one of us in every single state and all the U.S. territories, just like the AAA is, just like the ship. And what we do is we recruit and train volunteers and professionals about Medicare fraud so that they can then go into their communities and share that information, because our goal is to reduce the amount of waste that's happening in the Medicare system. And we are also a reporting agency. So you actually can call us toll free about any Medicare fraud that you are seeing or experiencing. And then we build that case and get it to the correct Medicare fraud control units. Okay. So I will go ahead, and our first question for the chat will be, do you know how much money is lost in a year to Medicare fraud, error, and abuse? That's the whole reason that this program exists, because there is a big chunk of money that is lost. So can anybody give me kind of a guess of how much money that is? In the chat, I have 3 billion. $3 billion is too low. 1 billion, definitely too low. That's not even, here we go, 45 billion. That one's much closer. And then Miss Valerie, she said 60 plus billion dollars, and that's actually correct. It is 60 to 90 billion dollars every single year. So that is a lot of money that is getting lost because of fraud, error, and abuse, which is exactly why this program exists. So we can try to reduce some of that. So now let's chat a little bit about Medicare. So as you know, we have Medicare Part A and B, which is kind of this traditional Medicare, right? So our hospital and our medical insurance that are combined. And then we also have our Part C, right? Our Medicare Advantage plans, right? So these are our private insurance companies that have that partnership with Medicare where they're able to offer Medicare plans. And then also we have Part D plans, which are our prescription drug coverage. I am fighting with this PowerPoint today. And so during open enrollment, we're actually able to switch our plans, drop our plans, add a plan. So that is whenever we have a lot of movement going on right there, right? And so as Leslie had mentioned, we have our open enrollment from the 15th of October to the 7th of December. So we have a couple of weeks left. And so now is really, really important. People are figuring out, okay, I really got to decide on a plan. I have to go ahead and enroll. So there's a lot of enrollments events that are happening, a lot of marketing that's still happening towards beneficiaries. And so it's really important to know what people can and cannot do. If you do have questions about enrolling in a plan, that is not my area of expertise. Rather, that would be more Leslie's side, right? So going to the Area Agency on Aging. So I have some contact information here for contacting Medicare directly or to find your local SHIP or your Area Agency on Aging. Okay. So as we go through this, we are going to be talking, can they do that? So of course, every year, the Center for Medicare and Medicaid Services sets out rules and regulations that agents and brokers have to follow whenever they are interacting with Medicare beneficiaries, right? They can't just do whatever they want and make whatever claims they would like whenever marketing these plans. So I'm going to give y'all a scenario and I'm going to ask y'all, can they do that? Yes or no? And I want you to put in the chat, yes, that sounds good to me, or no, absolutely not. That sounds super wrong. So let's jump into it, shall we? So first up, can they do that? Can agents state that they are from Medicare or use words or symbols such as Medicare, saying that they are with Medicare or endorsed by Medicare whenever they're talking about their plan? Monica says, hopefully not. And I'm seeing a ton of no's. And so that is correct. No, they definitely cannot do that. They cannot say that they are from Medicare. Medicare is not endorsing any of these plans specifically. So they do have to use CMS approved marketing language saying in the first minute of their call that they are not from Medicare, that this is a Medicare Advantage plan, XYZ. And all of these calls have to be recorded and stored to ensure that they are keeping up with these marketing practices, right? So if you're interacting with an agent and you ask, hey, do you have a recording of our last call? I just want to go over some details. And they say, no, we don't record any of our calls. Absolutely not. That information's private. No, all calls that they have with you must be recorded and stored so that they can be accessed. Okay, next up. Are they able to market door to door? Can they go door to door and leave materials, let's say at somebody's doorstep? I'm coming by, just knocking down, walking down the street, checking every door. Okay, this one's a mixed bag. Some people are saying yes, some people are saying no. Okay. No, they cannot do this. They are not allowed to walk door to door, leaving marketing materials at your house, sticking flyers to your door or door hangers. This is not allowed. It's basically like cold calling, right? Is cold walking up to your house, but they are not allowed to do this. They are able to leave information. If they had a scheduled appointment, they show up and you had stepped out and you're not actually home. then they're able to leave their information saying, hey, you can call me back. Here's like the packet that we were going to go over. But they cannot just show up at your house and start marketing to you. That's not allowed. Okay, what about this? Make unsolicited calls. We get unsolicited calls all the time, right? So are they allowed to do that? Does CMS allow people to cold call you? This is also a little mixed. I'm saying yes, yes, no, yes. Right? Because we get those calls all the time, probably every day during Medicare open enrollment. Tracy says we don't want it. Yes, they can, but we don't want them to. So actually the answer is no. They are not allowed to make unsolicited calls or cold call you. CMS says this is not allowed. This is not a legitimate marketing practice. So actually, they have to have a documented scope of appointment with you, right? So are they able to call or visit beneficiaries who attended a marketing event with documented permission? Can they do that? Can they call you or visit you whenever we've already chatted at an event and that you signed a document saying that it's okay? So this one is a lot easier, right? Because yes, of course they can if they have documented permission. That is the big thing, is having that explicit permission saying, yes, you can come to my house. Yes, you can call me. But how about this? What about unsolicited text messages or leaving voicemail messages? A different form of communication. I'm texting you, cold text messages. Okay, we're catching on now, right? That is a big no as well. They are not allowed to leave any unsolicited messages or to text you anything without your permission. What about approaching you unsolicited? Let's say we are at a health fair and they have a table and you're walking around and I walk up to you and I say, hey, I am representing this plan. I think it would be great for you. How about you come over here and chat with me? Seeing a lot of no's, seeing a lot of no's. And that is correct. They are not allowed to approach you unsolicited either. Even if you are walking past their table and they say, hey, come over here. I'd love to chat with you. That also is unsolicited contact. They're technically not allowed to do that. You have to approach them. And if they're calling out to you or beckoning you over, that's them making contact with you first. And it has to be completely solicited. Okay, what about we made an appointment together and now I want to call and make sure that we're still good? Does this sound like that's allowed? We haven't had our appointment yet, but I just want to make sure that we're still good for tomorrow at 2:30. And that's a resounding yes, right? That is yes. Of course, they can call to confirm a pre-existing appointment, right? Assuming we've already gone through all the steps to make sure that this contact is good and allowed. Okay, how about this one? Can we conduct marketing or sales activities in a private healthcare setting? I show up to the, let's say, the dialysis center and start talking about how great my healthcare plan is for people on dialysis. I saw a couple of yeses, a lot of no's. Janelle has a very strong no, no, no. Okay, and no, this is not allowed. The key word here is private healthcare settings. They cannot do any sort of marketing or sales in a private healthcare setting. But they can conduct marketing and sales activities in common areas of healthcare settings, right? So things like the waiting room, the lobby, the cafeteria, where it's basically just open to the public. Yeah, of course, they are able to go in and do whatever sales or marketing they want in there. But things like exam rooms, your hotel room, a dialysis center, the entire center, that is a private healthcare setting because you are receiving care. Pharmacy counters, this is a big one, right? People walking up to you at CVS and marketing their plan to you. That is not allowed. Absolutely not. Okay, so for all of this, there's kind of a common denominator, right? And it is having solicited contact with someone. If you are approaching them, calling them, text messaging them, emailing them without their permission, this is not allowed, right? So anytime that they are going to actually have a call with you, to schedule a call, some sort of chat with you, they have to have a documented scope of appointment or an SOA. Right. And this actually is a document. It's kind of like a permission slip, right? Saying like, you're allowed to talk to me for this long about these topics. So you actually have to have stated that we're going to talk about this kind of insurance policy. I have these kinds of questions. This is what we're going to go over. So they can't just start throwing things in willy-nilly and trying to loop in different plans or try to, stack plans with you, or let's also talk about life insurance while we're here. No, right now we're just talking about this Medicare plan, and these are the questions that I have, and our appointment is going to be from 1 to 2. And that is what I have signed off on, right? So that is our scope of appointment, and that is necessary for any sort of calls. But you'll see that that actually isn't super common, right? How many of us have gotten a call from an agent or broker during this open enrollment period completely unsolicited? If that's happened to you, I'd love for you to put it in the chat. Okay, what about this? Can they provide meals at a marketing or a sales event? Let's say I'm going to have everybody meet me at Papa Do's and we're going to talk about this awesome healthcare plan that I have. And then we can sign you up at the end after you get your free steak dinner. That sounds pretty great, right? It sounds like a really good marketing tactic. Can they do that? Yes or no? Let's see, is it considered a gift? Maria says they do that. I don't know if it should be done, but they do that. So let's see. They are not allowed to provide meals at marketing or sales event, right? So this one gets a little tricky though, because they can provide refreshments and snacks. Okay, so that gets a little bit dicey, right? You can kind of justify things one way or another. But it's supposed to be things like coffee or water, maybe a fruit tray. That's more considered refreshments and snacks. But sitting down and let's all have our steak or our chicken dinner at the Papa Do's or wherever we're going, I mean, that's pretty obviously a meal, right? I believe the threshold is $15. So if we're spending more than $15 on you, as Janelle said, is that considered a gift, right? That's kind of our max limit there. So they can do refreshments and snacks. That's kind of their loophole there. Okay, what about, can they do marketing or sales activities at an educational event? Things like distributing marketing materials or enrollment forms. So let's say that an agent is talking about common Medicare scams. They are doing an educational event about Medicare scams at a community center. And then at the end of the event, they go and they start distributing their marketing materials and their enrollment forms saying, these are all the scams, but we don't scam you. We would never scam you. Here's the plan that I'm with. Is that allowed? Seeing some yeses, I'm seeing some nos. No, this is not allowed. Those events have to be separated. That does end up kind of being a conflict of interest there, right? Someone is coming for an educational event, they're coming to learn something, and now you're switching it around and trying to sell something to them instead. So it's kind of like false marketing there, right? You're saying that you're coming, I'm offering a class, it's open to the public, no strings attached, and then you start being sold to. So that is not allowed. How about this one? Can they schedule appointments with beneficiaries who live in a long-term care facility or other congregate housing upon request by the beneficiary? So someone perhaps in a nursing home, in an assisted living facility, in a group home, something like that. Are they actually able to schedule appointments with people who live there? So y'all are all saying yes. A lot of people actually think that this is no, but of course it is yes. And our key word there is request by the beneficiary. As long as they are requesting it, as long as they are okay with it and asking for this person to come and share that information, it is totally okay. And so that is kind of the end of our can they or can't they section there. If you have any questions about other scenarios, please feel free to put it in the chat, put it in the Q&A, and I'd love to discuss it with you. It's really, really important to know the different do's and don'ts of open enrollment. A lot of people are getting marketed to right now. A lot of people are dealing with those scam calls or those illegal marketing practices and actually getting signed up for plans that don't exist, are not right for them, do not actually cover their area. I know a lot of us probably have seen the TV ads for different Medicare plans, right? They see your favorite celebrity endorsing a Medicare plan on national television, and you think, oh my gosh, well, if insert celebrity here supports that plan, I bet it's a great plan and I want to join it. But actually, Medicare plans are regional, and the plan that they have out in Idaho does not cover the same that it would over here in Texas. And even regionally here in Texas, it's really important to do your research, to slow down and actually look at what you're doing and take your time. You have the entire open enrollment period to actually choose a plan. A lot of people will say, this is a limited time offer. You have, only 2 days to sign for this, and then the deal is going away. It's a special discount. That's not how Medicare plans work. That is not true at all. So please take your time. We do offer free enrollment packets to actually fill out. It has helpful information, scam information, and actually a plan comparison section. So you can look at your old plan and any potential new plans that you have. We do have those available in English and Spanish, and we mail them out for free to anyone who is interested. So if you would like one of those, please feel free to email me, give me a call, and we can set that up either for you or your clients. Does anybody have any questions?
Thank you so much, Angel. This was great information as well. There were some questions in the chat that I tried to answer, so hopefully those were answered. There was one question. I think you actually answered it, but I just wanted to make sure. It was asking about the rules for marketers if it applied to the Part D solicitations as well. And the answer is yes. It applies to Part C Medicare Advantage as well as Part D standalone prescription drug plans.
Thank you for answering those, Melinda. And I can't actually see the Q&A section on my screen, I think because I'm sharing
Right.
the PowerPoint right now. So if there's anything else, if y'all could please moderate, that would be great.
Yeah, there's not anything on there. There was these same rules apply to Part D solicitations, and That's what you were covering, right, Melinda?
Yes, correct.
Yeah, that's what I thought. The
And I did want to also mention the Medicare and You handbook. It is a great resource, a great resource. Years ago, it was just so much information, it was hard to understand. But in recent years, they have kind of changed the wording to help us be able to understand the information better. And so it does answer a lot of questions. And the great thing is that no matter what a marketer tells you, you can go to the back of the Medicare and You handbook and be able to see the plans listed there. So they can't tell you, okay, you can get it for this monthly premium for this amount of, within the next 2 days. It's that premium is listed in the book. So it does not change for that particular year. So it's good to have that book handy if you are talking to any marketers or brokers or agents or even your local ship. If you're talking to your ship and you want a plan comparison, it's a great idea to have the book handy because when we do a plan comparison, we can provide you with 3 different plan options, the least expensive, and then we can direct you to where you can find information about that plan in the book and the phone number for that particular plan. So it's really helpful when, especially during open enrollment, when you are doing a comparison and want to see information about the plan and know for sure that it's a legitimate plan.
Angel, it's really helpful, the information you provide, the yeses and nos. The
Mm-hmm.
problem is it gets so convoluted at
Mm-hmm.
times when you say they can't invite you to a restaurant and feed you a meal. Oh, but they can
But
they can provide you a $14.99 prime rib baked potato and drinks and for a snack, and you're okay, right?
yeah,
Mm-hmm.
exactly. And so they find those little loopholes, and try to
Yeah,
stretch it as much as they can. So unfortunately, it does get super, super convoluted with a lot of these things.
yeah,
But at least we know they can't cold call us, right? And I feel like that's the
that's right.
biggest issue that people face every year is they're just bombarded with calls.
Mm-hmm.
Yeah, I'd say that facetiously about the meal, but no, seriously, that was very, very helpful to, like you say, that they can't cold call us. There are things they should not be doing, and you can report them, right? I mean, do they report them to you all? Is that right?
Yeah, definitely. So, easiest thing is you can definitely report it straight to CMS, and you can report it to our hotline, which I have here. As I said, we handle like anything Medicare fraud related. So if you see agents that are acting shady, doing improper marketing practices, if they're signing people up for plans that don't exist or don't actually cover them, that's a really good thing to get over to us as well. And that's also something that y'all should be looking for starting in January once all those plans hit, is actually looking and making sure that you are on the right plan, that your clients are on the right plan, because a lot of times people say, I love my plan. I'm not going to do anything. I'm going to leave it exactly how it is. I don't have to worry about it. I'm not going to do anything this year. And somehow or another, a shady agent switches them to a different plan so that they can get money. They
Mm-hmm.
can get the commission from them switching over to that plan. So we just want to verify that we're still on the correct plan. We're exactly where we need to be.
And we can, and that will show up in January then. Is it very good? Is there anything? I know, Melinda, you're in the heat of all the open enrollment, but is there anything else? Any other open enrollment tips that you have for people as we get down to the deadline here?
Yeah, thanks for asking. One of the things is just making sure you review your plan, as Angel just mentioned, because there could be changes. You could have received a notice in the mail about the changes, but haven't looked at it, or maybe it didn't get to you because we know how the mail system works. If it didn't get to you, if you didn't receive it, make sure and call your plan, because sometimes those premiums change or the co-payments change, and then January comes and you find out your plan has jumped up by 20, 30, $40, and that's something you may not be able to afford. One other option you have is in January, there is a Medicare Advantage plan open enrollment period where if you do have a Medicare Advantage plan, if for some reason, you got into a plan, it's not working for you, you can switch in January to another Advantage plan or to a prescription plan and go back to original Medicare. So there could be ways to get, to make a change if something happens, but it's always a good idea to review plans during open enrollment. Definitely.
Is there a penalty for switching back to original Medicare?
There is not. There
There's
is
not.
not. Mm-mm.
Okay.
No, in order to switch back to original Medicare from a Medicare Advantage plan, you would just enroll in a prescription drug plan and it automatically cancels the Advantage plan. And then you would be responsible for those deductibles and copays under original Medicare. Mm-hmm. And actually, last week I had received a call from someone stating that they received a letter from CMS that there was some type of privacy issue with their Medicare card, and they received a new card, and the number would be effective November 20th. I was thinking that was a scam, but actually my mother received one too. So of course I looked into it and it is legitimate. So there is something going on with privacy of some Medicare beneficiaries' Medicare number. So if you do receive a letter, feel free to call your local SHIP so that we can help you understand what it is. But that is something I was going to call SMP about.
Yeah,
But
it was a very large number of folks. I believe like 100 or 200,000 Medicare beneficiaries. Their information was in a data breach, and they are receiving new cards. So that will be getting sent out, and I'm sure people will be very freaked out by it. But it
right.
is legitimate.
Yeah.
Yes, because I was going to tell my mother, shred it, it's a scam.
Yeah. That's what makes the thing so incredibly difficult to keep track of. Is there's so many ands, ifs, or buts that go into it that just make it crazy. Things that you would think would never happen like that then does happen because of the data breach, and it changes the whole, everything we think that's not okay. Um,
Right.
Something changes it.
Yeah, and I do believe that CMS, Medicare, actually posts on their website any sort of special correspondence that they send out in emails or through the mail. So you can actually go and verify this is exactly what this is supposed to be. This is not a scam, this is actually Medicare communicating with me. They post that exact language online so that you can verify, just in case.
Oh, that's good to know. Thank you.
Yeah, of course.
Um,
I reposted the slides, Marty.
yeah. Oh, thank you for doing that. I was just scrolling down to see the new stuff here. Thanks. Thank you. Yeah. And again, those will go out in the follow-up email. Well, is there anything else that you wanted to cover? I know we're pretty early on, but if we've covered everything and nobody has any questions.
Leslie, did you have anything else that you needed to go over from your section of what's new?
We could talk about the if anybody's interested in knowing about the insulin coverage for 2025, what they need to know. I didn't do a slide, but I do have some information. I guess the most important thing is that the insulin has to be included on the Part D sponsors formulary, and that the deductible does not apply to it, and the cap is $35 per month. So that's really the only thing I can think of.
Okay.
I guess
Thank
they've been
you.
talking about this $35 cap for a while. A lot of people haven't heard about it, so.
Yeah, and that's a huge help because insulin used to cost a lot and people could not afford it. So
Right.
having that
Mhm.
that cap on it is wonderful if the drug is on the formulary. So
Right,
thank you for that.
sure.
I think that's it, Marty.
Well, there's a question that just came up. Yes, there is a council of governments in the Houston area. In fact, I think there are two, if I'm not sure, if I'm not wrong. I think one of them is Galveston and the surrounding areas, and one of them is for Houston. But there is a council of governments. If Maria, if you'll email me, I'll get you their information and send that to you. And my information, my email, along with the emails of our presenters today, will be in the follow-up email that goes out for you all. Well, thank you all. Thank you so much. Thank you, Lisa. Lisa, Leslie. Thank you. Great job. Thank you, Melinda. Simon, great job with the slides. I'm going to run over. Please hold them up for a minute because I do want to go over the CEU stuff real quick. And Angel, thank you so very much. Go ahead. What did you have to say, Angel?
Yeah, I was just going to share. I know that it wasn't in the curriculum, but I wanted to send out some scam information in the chat. But as we're getting closer to Thanksgiving and the holidays, and I know people are going to be off and doing Black Friday shopping next week. So I just shared some holiday scams that just talk about beware of fake sales, fake websites, shopping online, and that kind of safety around the holiday season. So there's a little tip sheet in the chat just for everybody's reference, because I know next week is going to be crazy with shopping. So good luck, everyone.
Angel, would you email that to me? I'm going
Of
to
course.
include I'll include that in the follow-up email as well. That would be great. So
Yeah.
I'm going to go back over this for those people that were joining us today for CEUs. I'm sorry, did you have something you wanted to ask, Simon?
No, sir.
Okay. For those of you that are joining us for CEUs today, we're providing licensed CEUs or CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or a license outside of Texas, feel free to go through the process, get a certificate, and submit it. But please note that that's who we're set up for. There's no guarantee they'll take it. I have had people before tell me that other jurisdictions have taken them, but there's no guarantee. I also have had jurisdictions reach out to me for more information on a event to try to determine whether it meets their guidelines. Also, we're doing certificate of attendance. Today's was worth 1.5 hours of CEU credits. You must complete the entire live webinar and the Q&A, and if we get done a little bit early, that's all right. You must complete the Google survey evaluation. When you close out of Zoom today, it should ask you if you would like to take a short survey. That survey will take you to our Google evaluation survey. If you don't get it there, you'll get it in the follow-up email that will go out tomorrow, and that follow-up email will have a link to the Google survey as well. Once you complete that, you'll have until the 2nd. Because of the holidays, I extended it a little bit. You'll have until December 2nd to complete that. And please give us about 4 weeks after that to get them out to you. they go out in a batch email all together, and it takes a while to put that together. But you will receive it by email. If you don't receive it by the second, you feel free to reach out and check on that. But please wait until then to check. It just gets really hard when you get a lot of individual emails asking about CEUs in advance, and trying to answer all those. It just sets us back even farther. So if you hold on, that would be great. Well, anybody else? Anything else? Well, thank you. Thank you, Leslie. Thank you, Angel. Thank you, Simon, Melinda. Thank you so much. And you all have a wonderful, wonderful day.
Thank you, Marty, for all that you do. Have
Thank
a
you.
good one.
Thank
Happy
you.
Thanksgiving,
Thank you,
everyone.
Marty. Happy Thanksgiving.
Yeah,
Bye-bye.
I thank you, Felicia. You were hidden. Sorry.
I know. That's okay. That's okay.
Thank you. Take care.
Until next time, take care.
Take
Okay.
care.
Bye-bye.
Bye-bye.